One of the last remaining countries to avoid an outbreak of COVID-19 is now seeing a surge in infections after community transmission was found just over a week ago. The Marshall Islands in the western Pacific Ocean, halfway between Hawaii and Australia, closed their borders at the start of the pandemic, implementing strict quarantine measures to keep the virus out. But a new outbreak has forced restrictions to be implemented, with a state of health disaster declared. So how had the Marshall Islands managed to keep the virus at bay for so long? Here's Jack Niedenthal, Secretary of Health and Human Services.
We had very strict protocols, quarantine, strict monitoring quarantine for people coming in from the US. And when they get here, they were also under strict quarantine orders. So we managed to do it for over 2 years without a single community case of COVID-19. We did have a few border cases, but this BA.5 Omicron variant is very, very contagious. It's almost on par with measles. So it swept very quickly through the community. I was like the 11th person on the very first day we discovered it. When I went home and did a self-test, I had it. So, and I've already recovered pretty much. But what we've been doing to fight it, we were prepared for this. We spent the last 2 years preparing. We have new COVID wards here, a lot of ventilators. We got all the vaccines. We got the ability to test. We got a lot of information. Now we have all the therapeutics like Paxlovid. So we've been handing out Paxlovid to all the vulnerable people and people who fit into a certain age range. We have 6 alternative care sites. We've kept COVID relatively free from our hospital. We have a few cases in there who have come in. But overall, I think our response has been fabulous here in the Marshall Islands. We've had 6 deaths, but we've had almost, we're over 4,000 cases now. So 6 deaths and 4,000 cases is a pretty good, I think, and very unfortunate, very sad for all of us, because it is a small island community here. We have about 25 to 30,000 people here in Majuro, where the big outbreak is now. And so we know all these people when they die. It's not like other places. So virtually every death is very hard for us.